Good afternoon, everyone. Welcome to our webinar from Outlier, AI in Healthcare. It's essentially finding your North Star. So just a quick overview of what finding your North Star is around, and it's around working towards your long-term goal as an organization. So looking at the strategy to get you to your North Star. That's primarily defined at an organizational level. And today we'll be talking to our experienced panelists, so Matthew Meldrum from Riskonnect and James Britton from Geriatric Care Australia, to talk through some strategies around AI in healthcare. And to commence the webinar, we'll just have a quick overview from Jasmine O'Reilly, the founder of Outlier, to take us through a quick overview story of digital transformation in this space. So I'll just bring Jasmine on now.
Beautiful. Hopefully you can hear me okay, Nick. Coming through loud and clear. Beautiful. Tech doesn't like me, but I love tech and I really love AI. And I want to start by saying thank you so much for being here at what is 12:30 p.m. here in Brisbane on the Eastern Seaboard as well. It's lunchtime. So hopefully you're enjoying some food while you listen to this great conversation today. And I also I genuinely want to say thanks for joining us because it's busy. Everyone's inbox is kind of overflowing and the calendar is a bit of a battlefield. And thank you for choosing to spend time with us. We do really appreciate it. But we're not going to waste that time. And as Nick said, I want to start with a bit of a story. And I do see actually that there's someone from one of my past lives here in the webinar today. And this story comes from that time. But it was actually an enterprise-wide project that I was leading for a very large healthcare provider where we were rolling out printers. Yes, printers. They still exist to this day. But what started as a scope of 12 sites expanded pretty quickly to be 71 hospitals and healthcare sites spanning 3 states. I don't know what you're thinking, printers, they're not exactly the things of TEDx talks or they're not the sexiest rollout, but stay with me because on paper, it was a very straightforward infrastructure upgrade. We had new hardware, we had better performance with this new hardware and simpler processes. And it was the kind of project that should have been low risk, low drama, done and dusted. Except it wasn't. Across 71 sites, what we were really doing was actually walking into 71 different cultures, 71 different workflows, and thousands of people who had their own way of doing things. And we were trying to tell them all to change and to adopt this new technology, which was hardware at the time, but you could apply that to AI today or any other tech that you're rolling out. So I think what's really important in that context and with this story is that what started us thinking that this was a piece of hardware and this was a tool that sat on a nurse's desk or a nursing station in a hospital, so to speak. Every single person used that tool in a completely different way, in a way that worked with how they do their job. And that stayed with me for many, many years. And so I always like to have that in the front of my mind, that we can't assume that we know how our people are going to use technology. And it's by asking them and observing them that we actually find the really cool innovation. So yes, the tech was the easy part, but getting people to adopt it and use it and maximize it, that's where the magic came in. And I'm really excited to have James and Matthew here today because they're looking at the magic. And we're going to hear a little bit about that in what they're doing in the AI space in healthcare. So Nick, over to you. I'm sure we're busting to hear from the panel. Let's go.
Thanks for that, Jasmine. Yeah, I thought it was a great overview. And as well too today, so we're about to kick into the panel conversation. We also have a Q&A functionality. So if you would like to ask any questions to sort of our panel, feel free. There's just a Q&A panel at the top of the webinar there. Add your questions in, and at the end of the webinar, we'll be covering them off and going from there. So without further ado, we will commence with our panel webinar. So just a quick intro of our 2 panelists today. We have Matthew Meldrum from Riskonnect. He brings over a decade of risk software expertise, helping global organizations drive change and process improvement. He specializes in clarifying priorities and building realistic technology roadmaps aligned with strategic outcomes. And we also have James Britton, who's the CEO of Geriatric Care Australia, delivering digitally enabled multidisciplinary care for older Australians. With global healthcare leadership experience, he advocates for outcomes-based models that improve access and reduce avoidable hospitalizations. Some very important work in the health space. So we will now commence our panelists' Q&A, and I think a great starting point is to understand, what does success in AI look like for you? So we might start with Matthew on that, and I'd be really interested to understand from your time working in technology, obviously working at Riskonnect, what does success look like to you?
Yeah. I think it depends really on the organization that you're speaking to in terms of what success looks like. Like, we work with a lot of companies in a lot of different roles and processes within here as well too. But to me, AI should be able to help make processes simpler, help give people time back to be able to spend that on things that are, I'd say, a little more value driven actions within there as well too. So AI should be able to help uplift, automate processes where possible, find and retrieve information, help identify trends and analysis within there as well too. Like that to me is when people want to look at what is successful AI is, it's giving you that information that you need and that you're looking for quickly, to help you spend less time doing, in our world, less time doing data management and more time doing risk management.
Yeah, I think that's really helpful in understanding, I guess, from that risk management perspective, which obviously has become a lot more sort of topical in this space, especially when it comes to AI now. I think companies are thinking about not only like what AI can do for me, but understanding from a risk perspective as well, especially when it comes to patient data and the sensitivity around us. And I think to build on that, James, really interesting to understand, being the CEO of sort of geriatric care and the work you do across health organisations in Australia, understanding the success criteria there as well.
Yeah, great. Thanks, Nick. So I might just give you a bit of a lay of the land as far as what we do, and then give you a bit of context to how we use AI to enable us to do better things, so to say. So we're a multidisciplinary team of GPs, geriatricians, registered nurses, nurse practitioners, care coordinators that deliver bulk billed access to care for older Australians all across the country. And we partner with governments as well as aged care facilities in order to do that. And we also lean heavily into digital health and AI, which we're obviously chatting about today. So what does AI success look like to us? It is fairly simple, to be honest with you. It's linked to outcomes at scale. So if we're able to, and when I say outcomes, I'm talking about clinical outcomes, I'm talking about economic outcomes, and also the emotional outcomes that patients go through during their episode of care. And if we're able to early identify, and Matthew was also touching on this, but the early identification of deterioration, things like better clinical decision-making at the point of care, and for us also, obviously, having fewer hospitalizations, all these things will help augment and strengthen the capability and capacity of the workforces out there, which is directly in our control as Geriatric Care Australia, but also our partners, the carers and the next of kins on the ground, of course, as well. So, but I will say, Nick, that AI is a lovely buzzword. I think in the description it was about AI and the hype, and to us, AI is not a strategy. It's the enabler of improved clinical decision-making, early intervention and scalable models and sustainable scalable models across Australia. And as an ops guy at heart, I don't look at AI as a solution. I look at it as the process of getting to that solution. So I think a lot of the times people look at AI and go, oh, great, I'll just plug and play and here we go. But really, it's just part of a multifactorial approach. So yeah, that's it for us.
Yeah, I think that's a really great perspective, James, and I think you touched on a very important piece around it's not just a tool. It needs to be part of a strategy, it needs to be part of essentially a plan, and looking at it as well from a data perspective, a strategy perspective, and obviously a risk and compliance perspective too, and just understanding, is it the right fit for the solution we're trying to solve? And I think to build on that then, I think the challenges a lot of organizations have is when it comes to especially AI adoption, it's like, what are the main challenges organizations are seeing, I think, when it comes to adoption. We've obviously touched around the risk perspective, it just being a tool being added on. Really interested to understand, though, other challenges organizations are seeing in this space. We might start with sort of Matthew around that and the types of challenges you're seeing organizations are having, and maybe organizations on the peripheral that they should be thinking about too.
Yeah, look, and kind of given my background as well, and I apologize, I just jumped in. James, you gave a great overview of what you guys do. Probably didn't do enough of that with Riskonnect and kind of my role, with the overview you gave there, Nick. But yeah, so Riskonnect is a risk management and compliance patient safety software tool. So a lot of times what we're doing is working with organizations that are trying to enhance or mature their risk processes, trying to enhance, especially on the healthcare side, patient safety and quality of care processes and things like that as well too. And every time, to me, when we come up with the conversation of AI, because I think James, as he kind of hit on there as well too, it can be a buzzword that some people just go, aha, AI, this will solve everything. And then you start asking the hard questions first of, okay, great, well, what's the data you're basing these decisions off of? And they go, well, I don't know. That to me is probably like coming from the data side. Like I started in implementation. That's always it. Where are you pulling this type of information from? Because unfortunately, when you look at a lot of consumer level tools within here, if you just go type it into Chat GPT within there without a basis of data to point it at, then you can get really wild answers. And unfortunately, hallucinations, while getting better across AI, can still be a problem. And when you're talking about that in a particularly heavily regulated clinical environment within here as well, that can be really dangerous, both for patient outcomes as well as organizational outcomes too. So to me, data and what you're looking at, there are aspects of AI like what they call RAG, or retrieval augmented generation, within here to say you're only allowed to look through these data sets that can assist with that. But I think data is probably the number one piece of it for me. And then I think the other aspect, and this is again kind of similar to what James was mentioning too, is organizational education. You may have folks within the organization that don't necessarily understand what AI is, and so sometimes it can be our job to reset those expectations and go in there. And sometimes it's difficult to say no. It doesn't quite do that, but I don't think of it always as a necessarily a hard and fast no, so much as we may not have the data to support that, and we really need to think about that aspect of where it's going to come up with our answers for us when you're looking at those more kind of broader, more complex problem-solving capabilities of AI. But that's probably the big one for me.
Okay, yeah, I think that's really helpful, and I think starting that's like that data layer is super important, especially when it comes to this type of data. It's obviously very sensitive, especially if it's into like that clinical context. We're obviously dealing with patient data as well, and how it's handled, how it's used, and the other risk we're seeing in organizations too is around the use of shadow AI. So in the sense that employees are using AI under their own use, under their own account, the type of data they're sharing and the governance around that does make it quite challenging. So I think, James, it'd be great to understand your perspective, obviously as a CEO of an organization, and the risks you're seeing around this adoption of AI, this emerging technology, and the challenges that maybe that you've encountered, or so like your teams have encountered, and having a look at how you've sort of overcome them.
Yeah, thanks. I think I'll kind of echo and put a different perspective on what Matthew said, but it's not going to be rocket science to people here, but you don't start with the tech, you start with the problem, right? And I think that's the biggest mistake I see, is that you start with AI and then you don't actually start with the problem you're trying to solve. And then what I mean by a problem is like, do you actually have a proper problem statement, goal, scope? How do you measure that problem? What data inputs do you have? What's this, how do you understand current state versus what you're trying to do for your future state? Like there's all these this is all stuff that is in project management ops land that's been around probably for 100 years. And I don't see how the use of AI is going to should change the approach of attacking problems. So we shouldn't look at it AI first. We should look at a problem first. And to me, in our organization, it's anchoring AI to a specific clinical or operational problem. I'll give you an example, right? So when we first started Geriatric Care Australia, we didn't know if our interventions were improving an outcome. And that sounds crazy to you all, but like at the end of the day, most doctors today, when they provide an intervention, they provide you prescription, they provide you a surgery. The follow-up care and outcomes 1 year, 1 week, 1 day after what happens and whether or not that intervention works is few and far between, let alone the data to prove that it worked. So what we've done is we've been able to use large language models and natural language processing to go through unstructured data sets and actually prove that before and after residents and older people see us, that we're actually reducing an outcome that matters to the patient and to the health system. So things like no one wants to go to hospital, but also it saves the health system money. So there's kind of like a double win there. We look at polypharmacy rates, which is medical deprescribing is a big part of that. We look at falls risk, pickup of cognitive impairment and dementia so that we put the right interventions in place on that. And what we find is that by starting with the problem, which is, hey, I don't know if my clinical workforce is actually improving an outcome for the resident, right? And then you start there and you work your way backwards. Well, how do we use tech? How do we use process? How do we use change management and people leadership to get a solution for these things? And we've seen some really awesome outcomes, which is great. And it's also a bit of a risk because you don't know that actually what you're doing is actually going to have a good outcome at the end of it. And you have to be a bit brave and a bit, I guess, curious to know that, okay, well, if we don't get the results we're looking for, we're willing to pivot, change, and bring the team with us. So back to your question around biggest mistakes, to me, it's you've got to start with the problem and then kind of work your way back from there.
Yep. I think that's a great way of sort of framing it, especially early on, really understanding the problem, then understanding how the technology is actually going to solve it, and then obviously working with your teams, the people to work through it and understanding it's like the best solution. And also you touched around being brave. And I think when it comes to new emerging technologies, it's so important to be brave. Take a calculated risk because obviously it is new technology. And as you also mentioned too, James, you may not always be aware of the outcome. However, you do want to make sure it's measurable and you're able to pivot, evolve as well. So being quite dynamic in your approach is probably also going to set you up for success heading into the short to medium term, and then obviously then aligning in that strategy into your North Star into the longer term. So probably then going back from a positive angle is around starting off in the early wins. What are some early wins that you've seen in the AI adoption that you've seen that has worked well in the companies that you've worked in? Sort of, Matthew, I understand they're doing a bit of work in that space, and Riskonnect and the companies you work with. Really interested to understand sort of those early wins that you're seeing sort of customers have in this space. I know that James touched on a couple of amazing examples that they're seeing at Geriatric Care. Really interested to understand though, Matthew, the early wins that you're seeing in the organizations that you're working across.
Yeah. Particularly like obviously on the risk side within here, there's I think a few different themes, I guess I'll say, of like use cases that we're tending to see within organizations. That'll range everything from that early warnings and trend analysis to say, hey, by the way, this is ticking upward and we're starting to see this becoming more and more of a problem across these multiple sites within here as well. So how are we able to kind of address that? And especially in organizations where, yeah, you may have 100 different sites or 71 different cultures, as I said in the intro within there as well. Are they all sharing and communicating that? So we're seeing organizations that are able to start looking at that a bit more holistically to do that kind of trend analysis within there as well too. We're working with organizations. I've worked with one, and unfortunately, I'm not going to name them because I don't want to get in trouble with my legal team within here as well. But one of the things that they're doing within that is identification of potential violations from a regulatory standpoint and even an internal policy standpoint when it comes to incident management within here. So they're looking at what their practitioners are doing, and a lot of that information is coming through unstructured data, as James was mentioning earlier, which I think is where AI is great. You look at, I hate to call them legacy technologies, but the more structured data sets require, hey, it has to be put into a field here where AI can read through large walls of text, basically. And what they're doing is they're bringing in the notes, they're bringing in the summaries of incidents to flag that and say this is either a SIRS incident, so it's or a Sentinel event within here as well too. It was highly preventable and damage actually reached the patient within here, flagging and identifying that significantly earlier in the process without having to have that level of human intervention. And as well as the fact that, hey, this potentially violated these 3 policies internally, organizationally, or we may be on the hook for these regulatory violations because these phrases or words, what we call risk signals, were mentioned within there as well too. So a lot of it is around that consumption of a large volume of data, flagging, identifying those trends within here. Probably less so on, I'd say, decision making on the risk side, but I think it's a really valuable tool for informing decision makers quickly and easily and flagging those types of things. So in our world, that's typically what I'm seeing. There's probably, and especially when you expand that out into the broader healthcare, because kind of a nerd and I like just researching these types of things as well too. There's some really cool things that AI is doing across a number of different clinical environments within here as well. Whether that's things like the identification and tracking of early indications and warnings of sepsis within here as well too. So there's case studies from like Duke and Johns Hopkins University in which they have some really cool programs they've put in place to be able to make that early warnings and identifications within there as well. There's the aspect of going back to a prior life, what we would call a force multiplier in terms of being able to take specialist type care and apply that to a large number of people within here as well. UPMC did something really interesting where they took the acute otitis media, which can be very difficult to, it's ear infection type that's very difficult a lot of times to diagnose. And they were able to train an AI model that had 93% accuracy, where a lot of their specialists were anywhere between 37 to 76% accuracy. And they can do it off of a smartphone with a camera that you and I could go plug into somebody's ear right now. So being able to take that level of specialist care and apply that out more broadly. Look, I'd probably spend the next hour talking about all the various cases. So I'm gonna stop talking now.
Yeah, I thought that was a really interesting sort of use case though, about sort of like that type of technology. And I think you touched on as well, James, about that early sort of like preventative healthcare space. I think it's really exciting, like kind of prevent it happening before it actually does happen. And I think as well, Matt, from a risk perspective, if you can identify before it happens, that's the ideal, because obviously it gives you time as opposed to after the fact, which unfortunately seems to happen a lot still. I think as well, James, you mentioned earlier, obviously trying to move to that preventative, sort of type health model as one of your strategic sort of drivers. I'd just be interested to understand, I guess, the early wins that you're seeing that are sort of getting you in that type of direction, obviously using AI and so like emerging technologies to get there, and maybe even some case studies, like some early wins you're seeing in your organization.
Yeah, sure. The foundation to everything we do is something called value-based healthcare, and again, it's another bunch of buzzwords, but really what it means is improving outcomes that matter to people and making sure you're doing it by either maintaining or reducing the cost in order to deliver those outcomes. And then trying to do that at scale in a sustainable way. Like that is, in a nutshell, what value-based care is. And one of the things I get excited about is AI enables me to prove from a data-driven point of view that our interventions and our model of care is improving an outcome. The cost side of things is easier to measure, but the outcome side less. And so as far as where we're heading, it allows us to augment or strengthen our clinical capacity and in some regards capability as well, but mostly capacity to by providing earlier insights to our doctors, as well as what we see at a macro level across populations and how we drive better interventions across population groups with local government providers and such. So I'll give you a couple of examples and I can give you a case study. So some examples of this are being able to look at unstructured data and clinical notes and then provide that in a more not necessarily identify, but more of a structured way that allows us to drive interventions for population groups, which we have already. And we have the largest, as far as I'm aware, the largest geriatric data set in the country. Or I should say the richest anyway. And then it also allows us to prioritize our workload better. So we're making sure we're seeing people at the right place at the right time. So as we move to these, I mean, to your question, Nick, as far as like how do we move to these like more proactive, like early intervention style models of care to keep people from presenting to hospital and aging a bit more in place and improving quality of life and these kinds of things. AI is very much living and breathing that space, and Matthew gave a couple of examples of those. For us, probably our biggest win is we've partnered with public hospitals in Australia to help with understanding how people present to hospital, how we can follow or help them with discharge planning, and then follow them up in the community with bulk billed appointments to then provide continuity of care. And, it's not just one doctor. We're talking about a multidisciplinary team that is integrated with the hospital, integrated with the local community providers, and we provide oversight and clinical care that is all bulk billed. And I say that because what we've been able to showcase is, gee whiz, you get a multidisciplinary team that's integrated and timely and data driven, you're going to see improved outcomes. Like we've seen preventable admissions to hospital fall off a cliff. We've seen falls drop dramatically. We've seen the identification of mild cognitive impairment, which 10% of those patients usually can lead to dementia. It's picking up it early and making sure we put the right interventions in place so it doesn't progress to dementia. And we're seeing huge improvements on this. And this is across population groups within a hospital's catchment area, usually in regional remote areas as well, where the inequities of access to care are quite poor. So that's just one of many, many examples that we have. But at the end of the day, we're using AI to enable us to ingest data to see if what we're doing is working, if I had to kind of oversimplify it.
Yeah, I think that's a great summary, James, and it's really exciting to hear from a patient perspective as well, obviously improving those outcomes, especially as Australia, obviously we have an aging population, and you appreciate the aging population too. It becomes more about the quality of life as you age too, and the preventative healthcare space, and then the work that sort of geriatric care is doing is really exciting. And having that outcomes driven approach, I think, is really important as well. And being able to use technology as a driver for that, and then seeing the actual outcome being obviously the patient care and the patient experience, I think is amazing. So now looking into moving forward, and obviously there's obviously a push from a lot of companies, executive boards around moving ahead with AI, adopting it at an organizational level, understanding, so the value drivers behind it. I think there's sometimes you need to take it back a step, and just look at maybe some early considerations. So specifically looking at a low risk step that, say, like the leader on this webinar today could take, heading towards looking at finding their North Star for AI and getting their organization a little bit more adopted when it comes to this emerging technology. So Matthew, I'd really like to understand from your perspective, what types of things these leaders could be considering, obviously heading into new financial year as well, and obviously the types of conversations they could start having with their teams too.
Yeah, I mean, James, I really hope I'm not about to steal your answer here as well. But what you were talking about earlier is something that definitely resonates with me, of like, what are we actually trying to do here with AI? Not just like, I have a hammer, what's a nail around me? But what actually needs to be nailed down is probably a really, really important step. So I'll leave that aside just in case I don't want to steal your thunder. But I think that's a very, very critical thing. What are you trying to do out of it? And then, I think there's probably no shortage of ways to go and connect with people who are doing similar things, whether that's through, organizations like Geriatric Care, or working with folks like myself and Riskonnect to say, hey, what are others doing out there? There's case studies. I think there's probably no shortage of folks that are very keen to talk about their wins and what they're doing in AI. So find somebody with a similar problem that they have solved, and study that a little bit. A lot of times you can go connect with people. LinkedIn makes everybody really easy to get a hold of these days as well too. Go drop them a message. People are generally very willing to talk as long as they've got the time to do it, about those kind of wins within there. So I think connecting with people who are solving similar problems, understanding the challenges that they've faced, working with those organizations to do that. And then to go back and harp on what I talked about earlier, understand your data set and what do you actually have available. And that may mean the data that you have within your own organization, but it may also mean leveraging data from, again, James mentioned that you got one of the richest data sets within Australia as well. How can organizations take and leverage those other available data sets out there, share that kind of information across one another to improve those types of outcomes? And then in probably typical risk management fashion, right? Risk rate, where you want AI to actually sit within that process. What are you actually having it do? Are you wanting it to inform and present to you information? Are you wanting it to take actions? So, hey, we have this very repeatable if this, then that process. We want to automate within there, take that and do that. Or are we wanting it to help drive a decision that it needs to be a little bit more complicated? So you can kind of start to break down the risk of using AI in that. If it absolutely goes wrong, what's the total impact to us as an organization? How difficult it's going to be to do that? That I think will start to help you identify where you may have those easy initial wins, where you may have more complex and complicated problems that you need to go solve, or kind of where it fits within there. And that'll probably start to give you a bit of a roadmap to say, okay, here's problems we can solve in the next 6 months. Here's problems that would take us maybe a little bit 12 months to 18 months or et cetera within there as well.
Yeah, I think that's really helpful to like understanding, there are other other executives and other leaders out there who have dealt with, similar challenges, being able to find that community, something we're looking at creating as part of the work we're doing today too, because it's an opportunity that we've also acknowledged around the case study, the lessons learned, understanding best practice approach, and how other companies have handled similar scenarios as well. I think that's super important. And then from that risk perspective to understanding the potential risks to the organization, obviously when you're dealing with quite sensitive data too, and the considerations around that, and just having those frank conversations internally, understanding the different perspectives and the different ideas that different stakeholders bring. And then also going over to James, obviously being the CEO of an organization, understanding those early wins that you've seen with your team, maybe looking at certain strategies that you've applied, adopted to be able to build that early confidence to obviously where you are now. It'd be great to hear.
Yeah, of course. I might start by piggybacking off what Matthew said as far as working with others and collaborating. It's not a chance we'd be able to do what I've talked about today if by ourselves. It's not a chance at all. We have partners in analytics and research. We partner with universities. We partner with government. We partner with aged care providers. We have to get consent from patients. Like it's not a just let's go do it thing. Collaboration is key, and I know that's it sounds a bit I don't know, buzzwordy again, but I do think you can't do this stuff in silos. And I mean, healthcare is already fragmented enough and siloed off enough. So we need collaboration on this front to get it right. And I agree. I said this at our prep meeting, Nick, but like I'll probably reiterate it. But one of the things that I've always said throughout my career is fail fast, fail fast. And I said that in an operational sense, but never in a patient safety or quality of care sense. And one thing we've done with AI is actually quite the opposite. We've done start very slow. It's been start quality first, quality over speed. And you don't, given the attention on AI, the attention on healthcare delivery services, the attention on, especially on patient outcomes, especially when it comes to tech, you can't fail, like period, in my opinion, right? So you have to build systems that are error proofed and have clinical oversight and human oversight to ensure that the AI is being used in a way that actually is going to deliver the top-notch quality outcome. And I say that because it's taken us years to get to this point. And we are currently actively working on predictive analytics to pick up on health deterioration, but by no means am I saying that's a clinical decision. That's actually just one of the many support tools we're going to use in our ecosystem to enable better outcomes. So when you say, where do you start? I mean, you have to work with others that are experts. You can't be an expert in AI and in what you do, in my opinion. Like you have to collaborate. And then you got to trial and start. And there's no better time to talk to, whether it's partners like myself or through Matthew's team or others, or even your team, Nick, as far as getting advice on where to go. And this might actually be a good tee up for your your workbook that you have or the how to get started. But like I do think it's a bit of just getting in front of the right people and making sure you're taking risk and quality into hand. And for us, we make sure everything that we're working on is research grade, because we want to punch out white papers and research papers on what we're doing. So that's our kind of also the standard that we're operating at.
Yeah, I think that's super insightful, James, and that piece that you both touched on around collaborating in industry, obviously with experts as well, and to then really understand the problem you're trying to solve, really be outcome driven. And again, just getting those early wins on the board, being able to build trust in your organization as well, is super important. And it's one of the biggest challenges that we've seen in organizations is just around that early adoption. And as you mentioned, James, that was a very nice lead in to our next slide, which is around the 90-day AI guide. So it's a resource that we've built at Outlier to really help organizations get started, understanding the outcome-driven approach, understanding the value drivers, and being able to build that early confidence in organizations. It also creates momentum as well, standardizing what works, and obviously creating a clear path, because we understand it does take time to find your North Star, especially when it comes to new technology adoption and making sure it's very outcome driven. And so it's a resource we will be sharing, and it's a real focus from Outlier to share the work that we're doing with the community, like the community we have available today, and really work towards sort of driving that adoption and obviously the outcome-driven approach with obviously the people-centered design that we have here at Outlier. So without further ado, we'll continue on then to the audience Q&A. So again, as I mentioned earlier, if you would like to ask a question to the either James or Matthew, you can obviously add that in to the Teams Q&A. We do have a couple of questions that were asked before the session though, so we'll get started with those questions. So again, this will be for both of you. I guess we always get these questions, but just understanding the types of governance and guardrails that are essential before scaling AI, especially when it comes to clinical data. So the types of considerations you have around that. So we might start with Matthew.
Yeah, there's no shortage these days of obviously cyber laws and regulations out there in terms of what you can do and can't do with people's data. I think it goes back to looking at is it PII, so personally identifiable information? Is it PHI, so personal health information? If you wouldn't be fine emailing it out to somebody random, don't plug it into AI to start with. I'd say it's commercially available AI. You talked about like the shadow use cases of I just copied and pasted it and threw it into my own chat GPT. Yeah, that's a risk. That's a compliance risk for sure within there as well too. So there's a lot of considerations to be taken, and there are frameworks that are coming along. But I will say that the development of AI is going significantly faster than the regulatory environment is currently capable of keeping up with. So I am a big believer that compliance is exceptionally important, but it is not the same thing as organizational resilience and that ability to be able to understand what it is that you're doing, and to keep yourselves afloat if you get into trouble. So yeah, checking the box in terms of saying, yeah, we're compliant is great, but it's probably not enough to keep you safe, and to avoid those types of negative outcomes. So I think a lot of it goes back to, as I kind of said before, understanding the risk of the problem you're trying to solve. And hey, if we make a mistake, then okay, yeah, we're a day behind on a paperwork or something like that. That's fine. But as James was mentioning, you really don't have the option to fail when it comes to patient outcomes and their health and care within there as well. So compliance is a good indicator, but I think that still takes that human thought and intervention of saying, what else are we, where's the real risk in this, and what's the actual problem beyond compliance?
Yeah, I think that makes perfect sense. And those types of considerations that organizations need to have up front. And I think that example you used around if you wouldn't send this, if this email, contains, patient data, you would not be plugging that into a, so like a generative AI tool. and always having that type of mindset. And I think it goes back to that earlier conversation around education and the education across the organization, and always thinking from a risk perspective when it comes to especially patient data. So it'd be interesting to understand your perspective then, James, around these types of guardrails. Obviously, you'd have to have a lot of guardrails with the types of patient data you deal with, and now with AI, obviously that brings an additional level of complexity to that.
Yeah, there is a lot of layers to it. And it's obvious it has to come, safety and quality and privacy has to come first. So I mean, we have a couple of things as a hospital or any clinical services provider would have. You have to abide by the Privacy Act, and you have to have consent and privacy policies, and there's a whole lot of moving goalposts when it comes to regulation. As Matthew said earlier, it's developing faster than the rules can keep up. So you kind of have to set a standard in those ways, which we're trying to do. And we do that by not looking internally and going, oh, we're doing a great job, let's do this. It's actually looking externally to things like going through ethics committees and universities to make sure what we're doing is passing that high standard and bar. In addition, I mean, even recently, what was it, last week or this week, the Claude Mythos thing came out around, all the cybersecurity risks with that. So then you have to really look into, are you protecting and sourcing and being a good custodian of this identifiable health data as service providers? And then how do we share this data in non-identifiable, aggregated, and even anonymized ways that allows our partners to see the impact that we're having? So there's a lot of different things to consider, of course. You have to be on top of all of it, and there's no excuse not to be. But that probably is one of the first cabs off the rank that anyone wanting to go into anything AI is to try and just really understand the risk associated with regulations, compliance, privacy, and consent. Those are all very, very important.
Yep, exactly. And I think it's really interesting how you mentioned how you're using sort of looking at different standards as well, working across different organizations, especially when it comes to like the universities and it's like those research type organizations to really refine it and obviously continuously evolve, because obviously there will be new technologies, and I guess it's understanding how you best like adapt to them. And also to, I guess when it comes to new technology, there's obviously that fear, that employees obviously have around AI, obviously from a future skills perspective, an upskill perspective. And I think Matthew, it'd be interesting to get your thoughts around that and sort of how organizations should think about that when it comes to, the threat new technology, faces with an organization, and obviously when it comes to adoption as well.
Yeah, absolutely. I mean, I think use of AI is a skill, right? We've probably all done it where you go in to your own version of a chat GPT and you write down a prompt and then it comes out with an answer and you're like, oh, that wasn't quite what I was looking for. So you have to refine your prompt and you're like, that's a little closer to what I was looking for. So to me, there is a difference between a skill, I should say, in terms of prompt engineering and what it is that you're trying to ask AI to do, because it's a lot of times going to do exactly what you ask it to do, no more, no less. So you have to know how you're going about that. And I think individuals and organizations that tackle that the best are the ones that are setting themselves up for success. And in terms of thinking about, and it goes back to that problem definition. What do you want it to do? What are you actually trying to get out of the tool itself? And then again, going back to where am I trusting it and what do I want it to do, right? Like, I think that is probably the biggest consideration. And there's no shortage of ways to go learn about AI these days as well, too. You can have AI teach you about AI in some ways, but again, trust but verify with the information that comes from that. But I think there's ways individuals can go about upskilling themselves in terms of understanding where AI applies and doesn't apply. And then, as James was mentioning, there's plenty of situations you are never going to remove the human element within there. So you definitely shouldn't, I should say. So you're still going to need that aspect of it to be able to do that piece of it. But yeah.
Yeah, exactly. And how have you handled this type of situation in your organization, James? Obviously, we've spoken about education because obviously that's super important across the organization. Are there other ways you've also handled this across your organization when it comes to adoption?
Yeah, I think we're quite unique in aged care that you probably have never met anyone who works in aged care that has time on their hands. So when you say, we're going to give you AI to help make your job more efficient. Like for the most part, it's welcome because they're like, gosh, thank you. I need about 5 more people working on this, right? There's a lack of doctors, lack of nurses, lack of aged care beds all across the country. There's bed blockages in every public hospital. So like there's all these macro micro problems across the country in aged care where I think it's, and I don't want to be brave enough to say across all healthcare, because maybe not in things like cosmetics and things like that, but like I do think in the parts of healthcare that are really struggling, which is one of them would be aged care, another one probably a good example is mental health. There's a lack of resources. So the AI, I think, in my experience, has been welcomed. It's just the hesitation is around that privacy, compliance, all that stuff we just talked about in the last question. So I do think if people are looking to pivot their career or look at places to work, one of the things I keep saying is like there is a bit of job security in aged care, just because at least for the foreseeable future, there's a tsunami of older people that are only getting more complex and only getting older, that need caring for. So we look at least I look at it, I know my team does, and a lot of our partners look at it as a way to kind of strengthen and augment what we're doing.
Yeah, I think that's a great approach, James. And yeah, that's how we're sort of looking at it too, from that outcome-based approach, and obviously working with, the existing team, understanding, areas of their role, especially when it comes to admin and that could be automated, as well. So yeah, this has been a super helpful sort of webinar. We've really explored different areas of AI in healthcare. We've looked at it from that risk perspective, from Matthew's perspective, what he's seeing in organisations through Riskonnect, and understanding from James, especially in the case studies and the early successes they're having at Geriatric Care Australia, obviously using technologies such as AI and sort of automation, and it's great to see it leading to high quality patient outcomes, which is really exciting. And from a next steps perspective, something small we're looking at doing from Outlier is opening up a new site called Outlier Labs. And it's going to be free shared resources around change management, AI, specifically in sectors we focus in, such as healthcare. And this will be coming live mid this year. And it's to really help organizations starting out from an adoption perspective, looking at workforces and kind of what the future of work looks like, essentially in a world of AI, obviously being very outcome driven and obviously working closely with the people. So we hope you're interested in joining Outlier Labs. But that has been today's webinar on AI in healthcare, finding your North Star. So thank you everyone for joining, and thank you for our panelists, Matthew and James.
Thanks, Nick.
Sure.
Thanks everyone. Cheers. Bye.